Hi, I'm making this video to explain how I use the theory of androgyny from the book The Adult Learner by Knowles, Holton, and Swanson when making my video on giving and receiving feedback for medical students. Knowles, Holton, and Swanson put forth 6 assumptions that they have about adult learning. The first is the need to know. They feel it's very important that adults need to know something before they're motivated to learn it. And if you're going to be teaching or doing an instructional video, you need to know what it is that your audience or learners feel that they need to know. So with that in mind, I have a focus group of 4th year, 3rd year, 2nd year, and 1st year medical students that work with me. When we did a survey of medical students and faculty to find out which topic they felt they needed to know. And invariably the topic came back as feedback. Giving and receiving feedback is a skill that benefits everyone. And it's going to benefit especially people going into the medical profession because they're going to be giving feedback to patients throughout their medical career. But in addition to that, they're students, which means they're going to be giving feedback to their instructors as well as getting feedback all the time, and that's going to contribute toward their clinical clerkships. The author's second assumption is that learners have a self-concept. They have an idea about themselves. They have an idea about what's important to them. They have an idea of what I tell my medical students is their brand, what it is that they put forth to the rest of the world as being them. So learners knowing that and knowing what they feel is important and what is their brand are going to be most interested in learning things that solve a problem or have a certain role or fill a gap in their life right now, whether it's socially, academically, or in their workplace. Giving and receiving feedback fits that. All medical students need to be able to give and receive feedback effectively. They would like to think of themselves as good communicators and being able to share knowledge well. Being able to give feedback fills in with that. It is part of their brand. It is part of what makes up a good clinician. The third assumption is the role of experience. With that in mind, in addition to doing the survey and finding out what it was that my medical students needed to know, and knowing with a long history of medical experience myself as well as working in the medical school what it was that good clinicians need to know, the next thing was to figure out how I can take all of my learners' experiences and put them into our course. So in addition to making a video, I'm going to make the video optional. Why is it optional for the medical students? Because some of them have been giving feedback and receiving feedback effectively their entire life. They don't really need a video explaining how to do it or a protocol on how to do it. By making it optional, I leave it up to them to decide whether they feel they need the video or not. In addition, as the assessment at the end of the video, students will be reading a case study and determining how they would give feedback to the scenario or the people that are in that particular case. A case study, by design, is going to take all of your previous information and experience and give you a point of view. And you'll express that point of view or your way of looking at things when you evaluate the case study. Readiness to learn. Are my medical students ready to learn about feedback? Well, medical students usually are described as having a type A personality. They tend to be at the top of their class. And now for the first time, they're going to be in a group with a bunch of people who are all at the top of their class. So they usually walk in the door asking, how am I going to get an A? Or how am I going to get a good clerkship evaluation? Well, giving feedback is really important in our active curriculum. Our active curriculum requires group work. And as part of that group work, everybody is constantly giving everyone else feedback, and that contributes to their grade. In addition, they're giving their instructors feedback. And by giving their instructors feedback, they are giving people feedback who are in one way going to contribute to their education and eventually become their colleagues. Last, the 3rd year is their clinical clerkship year. Now that's really important because during that time, medical students are always going to be evaluated, and it's going to be much more subjective. They're going to be given feedback regularly, and their ability to incorporate that feedback and determine what's useful and what's not useful to them is going to be very important to not only improving their patient skills and their decision making, but also in the clinical clerkships that are going to be found in their medical student performance evaluation, which is sent on to their residency program directors and can make a difference about what residency program they get in. So for that reason, I feel they will be ready to learn. Orientation to learning. What is your perspective towards learning? What do you think about learning? How comfortable are you with learning? Well, by the time you have finished high school, college, and now are in medical school, you're usually pretty oriented towards learning. You want to know what will make you better at what you do. You want to achieve both for yourself the best scores that you can, but in addition to that, you need to learn decision making. And the only way to improve your ability to make decision making and improve your clinical skills is to ask everyone else how you're doing. Frequently, people say you're not the best judge of your own abilities. You need someone from the outside to judge your abilities and tell you what you can improve and what you can't improve on. Communication skills are such a vital skill for everyone in the medical profession. So being able to communicate effectively is something that everyone needs to know how to do, especially medical students and future physicians. It's very difficult to tell how well you're communicating yourself. You need an outside party to help you evaluate that. And then finally, learner motivation. Is feedback a topic that learners will be motivated to learn? Generally, in medical school, medical students are motivated to learn anything that's going to give them a better grade. So, as I mentioned before, there is that internal motivation to improve both academically and to score the highest grades possible and get the best clerkship evaluations possible. But there's also that external motivation and that desire that's more altruistic to improve your clinical skills and make yourself a good clinician for your future patients. So, in summary, this video was based on survey results of what my learners wanted to know, so they therefore felt they had a need to know it. As far as their self-concept, feedback is something that will be incorporated into their brand, both in their communication skills as well as their clinical decision-making skills. I'm going to incorporate their experience in two ways. One, making the video optional, so if they've already got the experience they need, they don't need to watch it. And second, utilizing a case study as my assessment in order to take advantage of all of their different perspectives. They should be ready to learn. I mean, they're kind of professional students, and so they're motivated to pick up as much material as possible, and they know that's what's going to happen in medical school. The orientation to learning, they're ready to know both improve academically as well as their clinical decision making. And finally, they're very motivated to learn by both the altruistic need to improve themselves, to improve their decision making and clinical skills, as I mentioned, but also to get the best clinical evaluations that they can in order to get into the best residency program that they can.